Hi, evening guys, how are you doing? I thought I'd make this quick video about a topic which comes up a lot, and that's about doctors making mistakes or health professionals making mistakes, and what we should do about them and what lessons can we learn from them, and as a society or as a community, how do we actually approach these things. So I'll give you the story. This is one of my friends was just telling me recently that there was a child who had come to see the doctors 3 times with their parents, and the parents kept complaining that the child is very tired, very sleepy, not wanting to eat, and every time they've seen a previous doctor, the doctor has told them, oh, he's got a viral infection, he'll get better, just give him some water, maybe some Calpol, and the child will just get better. Anyway, thankfully this family turned up for the 4th time now, seeing a different doctor, which happened to be my friend. And my friend just felt that something wasn't particularly right here and something was slightly off. The child looked really listless, he looked really tired, he wasn't engaged in the consultation at all, and that's not what you normally get from children. Children are normally like monkeys, jumping around, trying to put all your equipment on, jumping on the scales. So he knew something was up. And thankfully he made the right decision to send this child to hospital again, and this time with a note saying, I'm really worried about this child, please don't send them home without some blood test or some kind of scan. Now this child had already gone to 2 different hospitals before and been told that there's nothing wrong with them. Unfortunately on this occasion it turned out the child actually had some kind of cancer, some kind of tumour, and it actually spread a lot throughout their body. And as you can imagine, the parents were devastated, and they're very angry and they're very upset. And we have to ask ourselves, how would you feel if that was you? Would you feel let down by the doctors and the nurses or whoever's come across your child? Would you feel that these kind of mistakes happen and it's understandable and an apology will do, or would you want to take it beyond that? And I think that's a really difficult subject, because when you're working in this kind of profession, you never want to make a mistake, but we're human, we all make mistakes, and we get tired and we get hungry and we get complacent sometimes, as best as we don't want to be. Sometimes it's a long day, sometimes it's the 20th child you've seen that day, sometimes you've seen this family so many times and they've come with so many similar problems that you think, here we go again, they're just talking about the same issue which they've presented before, and it's that one time that you're going to miss something very serious and you're going to miss something very important. And unfortunately with this child there was something serious and there was something that was missed. So from a patient's perspective, you can understand, because these stories, they do get out and they do get reported about in the newspaper, and the next time that family will visit the doctor, they'll probably have no faith in the doctors, and the next time the doctor, who probably will be correct in the future and say, look, this is just a bit of a viral infection, they won't take their word for it, and they'll probably try to end up taking that child to accident emergency again. So what can we do? How can we learn from these lessons? How as a society can we accept that when somebody's making an error, that it's an honest mistake, that it isn't a case of negligence in every single scenario? Of course, sometimes there is negligence, and health professionals are not perfect, but the majority of the time when things go wrong in medicine, or a diagnosis is missed, or a treatment is inappropriate, rarely is it the case that somebody went out of their way to do you harm or to do you an injustice. And sometimes it's just down to, very bad luck that this 1 in 100 presentation has actually come up. And a brain cancer in a child, which is spread everywhere, presenting in that way, I can tell you is very, very rare. So it's a very, very hard tale to tell, but these are the things that we have to approach in a better way, rather than just trying to sue and get money and ruin people's careers over these mistakes. Because I'm telling you that anyone involved in this case will be absolutely heartbroken for that child, first and foremost, and for their family. And they won't feel any rest that even if they got away with it, they won't feel easy at all. And every child they see after that, trust me, they'll approach that in a different way from now on, probably over-cautious and over-investigate in the future, because they never want to make that mistake again. I think the more that patients realise that the doctors and the nurses that they come across get very affected by these cases as well, because we feel heartbroken whenever we make mistakes. And I've made plenty of mistakes in my time. Mistakes happen. We need to learn from those mistakes and not go on some kind of vendetta where we think all the doctors are stupid, or all the nurses are careless, and all the other kind of things you sometimes read in the media as well. My heart goes out to that child and to that family, and I hope that as well as the family and the child getting support for that case, that anyone involved in that case is also getting supported, because they'll be having a really tough time at the moment and they'll be struggling to practice having that weight and that burden on their shoulders. But that's the responsibility that we take, and that's what we have to live with at the end of the day.